Mo Alum today is going to talk about coronavirus, which has affected 45,000 people around the world and shattered lives of 1,000 plus people. Today we have Dr. Shashiraj with us from KIMS Oman Hospital, who would share tips and precautions to save ourselves from this dangerous virus.
Coronavirus is a group of viruses. It belongs to a family of viruses. We have seen outbreaks in the past as well. Normally it lives in both animals as well as human beings. It infects animals and it can spread to human beings as well, and human to human spread is also possible. Normally it causes a mild respiratory infection like sore throat, cough, fever, shortness of breath. But at times it can become even very severe. It can cause severe pneumonia, respiratory distress, respiratory failure and death as well. The lethality is not known yet because it's still evolving disease. We don't have much information, but looking at the figures, as of today, about 45,000 people have been infected. Out of that, 1,115 people have died. So, which means the case fatality rate, the mortality rate is roughly about 2.1%. But compared to other coronaviruses which caused similar infections in the past, like SARS, which is severe acute respiratory syndrome, which was seen in China in the year 2003, the fatality rate was 9%. 9% of the infected people died. And subsequently in Saudi Arabia, we saw an outbreak of Middle East respiratory syndrome, MERS, and the case fatality rate was 33%. 1/3 of the people who were infected died. But fortunately, the infection did not spread much at that time. But this time, it is about 2.1% as of now, but this may change. To diagnose, it is similar to any other seasonal flu. People normally come with sore throat, cough, fever, shortness of breath. So to differentiate, we have to collect specimen from their either nose or from the throat and send it to a laboratory to do this testing. It is the diagnosis is by polymerase chain reaction testing, PCR technology, and you get the report within few hours. There is no specific treatment as of today, and you asked me about the complications of this. Complications are normally it's a mild disease, but it can cause severe respiratory distress, respiratory failure, pneumonia, and even death as well. There is no food as such which can help to cure this illness, and there are no specific medicines as of today, but WHO is trying to bring a vaccine for this. It may take about 18 months. So what precautions one can take? Yes, hand hygiene, very important, because when a person coughs, this normally spreads by droplets. When patient coughs or sneezes, the bacteria, the virus comes out in droplet form. It may fall on the table, it may fall on, it will be there in the air, so you may inhale. So we have to wash our hands with soap and water or with alcohol based hand rub, and we have to wear mask if possible, and also request the patient, whoever is coughing or sneezing, to wear a mask so that it will not spread. Other thing what you can do is maintain a safe distance. If you maintain a safe distance of about 1 meter, chances of getting infected is also very less. And if somebody is suffering from this kind of cough and cold and respiratory distress or shortness of breath, ask them to go to a doctor at the earliest so that they can be tested and diagnosis can be made. But normally, if you are not traveled to China in the recent 14 days, or if you have not come in contact with any person who is already suffering from coronavirus infection, chances of you having coronavirus infection is very less. And this disease is known as COVID. It's been named as COVID because corona viral disease 19. So recently WHO named it as COVID-19 disease.